Okay, so on the top, there's a couple of careers that I wanted to talk about. So if any of you are interested in any of these specifically, just let me know. You can raise your hand when I get to the slide so I can tell you more about it. So the slides I have are medical technician, physician assistant, nursing, health informatist, and clinical analyst, office manager, and physician. But of course, there's so many other careers, EMT, medics, social workers, almost like there's so many different careers in the hospital too. Peace Corps volunteers as well. So in terms of a medical technician, basically you're helping the office staff answering phone calls, answering questions, helping the doctors take vitals, doing paperwork, collecting fluid samples, urine pregnancy tests. And then for this field, you don't need to have a bachelor's degree. You can have a high school diploma, GED, and then you would have to do a program of 9 to 12 months or up to 2 years. And then you would have to get a certification, so do an exam. And then their starting salary for that is about $30,000. On this graph, you can kind of see, so the type is a little bit small, but medical assistant is all the way to the left, and then dental hygienists, dental assistants, LPNs, which are types of nurses, and nursing assistants. Okay, and then this is also kind of small too, but this also goes over some of the salaries. So for a dental assistant, it says about $30,000. There's pharmacy assistant as well. And then as you work your way up, so registered nurse, the average salary is about $60,000. Nurse practitioner, I think it says about $80,000. And then doctor physician is about $150,000. So of course, with the salaries, there's more training involved as you move up through the numbers. Okay, and then this is another graph about the salaries. Okay, and then the next topic is physician assistant. So this one, you would have a bachelor's degree, and then you would need a 2 years master's on top of that. And then 2,000 clinical hours. So you would have to pass an exam. If you wanted to do specialization within the physician's assistant, so orthopedics, you would do additional training on top of that, and then you would be certified every 6 to 10 years. Another career is a nurse. So within the nursing realm, there's so many different areas you could pursue in. So if you were to have a bachelor's of arts degree, so such as if you went to Drew, you would then do an accelerated bachelor's of nursing, which is an extra 1 to 2 years, and then take an exam, or you can do a master's in nursing as well. You can also do a doctorate in nursing, and then you would get a license every 2 years. And then within the nursing degree, I do want to talk about midwives and anesthetists. For midwives, the average salary is about $90,000. So for OBGYNs, we work a lot with midwives, and so they can do vaginal deliveries. They don't quite do cesarean deliveries or C-sections, but they can be in the operating room and helping, but they can't be like the first assist to the physician. So that would be extra training, a master's degree, and then a nurse anesthetist. So the starting salary is about $100,000. The median salary is $150,000. So they start with sedating patients. So because there's a high risk involved in that, the salary is much larger, or a higher number. And then I do want to talk about health IT as well. So anyone who's interested in technology, there's a big movement to employ people to help with medical records, getting information, collecting data, doing research. So for this, the average salary is about $86,000. Finally, I want to talk about office management. So this would be supervising the nurses, the medical techs, the doctors, looking at budgeting, revenue. So this, actually, I pulled this information from a job listing. So you do need a bachelor's degree or a graduate degree of an accredited 2-year business college. And then this one job listing asks for 10 years experience. And then finally, because we are physicians, this is the most comfortable topic. So first you have to take your MCAT. So after graduating with a bachelor's degree, you would take an MCAT. Then you would do 4 years of medical school. Within the medical school, there's 2 years of lecture, usually based areas of study. And then after that, you would do your clinical rotation. So that's about 2 years, and you would spend 2 months, and usually about 2 months in each rotation. So internal medicine, OBGYN, surgery, psychiatry. And then after that, depending on what residency you would want to go to, it's 3 to 7 years. So pediatrics is like 3 years, neurosurgery is 7 years, OBGYN is 4 years long. And then after your residency, you would get board certified. So it's an exam, both written and oral. So most of this information from the slides is from this one website, www.learnhowtobecome.org. And then this is just what the website looks like here. After you finish medical school and you start your residency, then you would get paid a salary. So usually the starting salary is about $50,000, depending on where you go. And then it increases about $3,000 or $4,000 per year. And then once you get to the attending status, so after you complete your board certification, it can be up to $150,000 to $250,000, depending on where you go. Usually the starting salary is a little bit, on the lower side. Loans, oh goodness. Okay, so I don't know how much the starting for here is annually, but when I was here, it was about $50,000, $60,000? Okay, so times 4, right? Okay, then medical school is about $60,000 per year. Depending on where you go, so I went to Rutgers Medical School, which is a state school. It's a little bit cheaper. It's and I live in Whippany, New Jersey, so it's a little bit cheaper in that sense. If you went to Penn State, of course, you would have to pay out-of-state tuition. It's kind of like undergrad. So that's about $60,000 a year. And then once you start your residency, then you start getting paid, which is nice. Do we get free healthcare? No, I do pay about $136 a month. Not that I'm counting, but yeah, you do have to pay. So you could pay for medical, dental, prescriptions, and then usually they offer you a plan, so you can choose which plan is right for you. So if you say you want to do a lot of, like you want to see your primary physician, you want to see an OBGYN, you can pay for a plan where you see them regularly, or you can pay for a plan that you would say like, if I really needed to see a doctor, I'd rather go to the ER. So depending on like what type of healthcare you're looking for, you can select a plan. I think it's helpful. I think that influenced me on becoming an OBGYN, and also because of my friends, they asked me for advice in terms of contraception. So for me, that was an interest. We're supposed to see.
I might want to interject. I can't resist. There's an old saying in medicine, those who treat themselves have a fool for a doctor.
So one of my favorite professors or lecturers gave a lecture recently about cervical cancer. So like he was giving a lecture to OBGYN residents, and so his first picture was like cervical cancer, and he was like, I hope this is motivation for you to see an OBGYN, because I'm sure most of you are not seeing OBGYNs regularly. So, even as an OBGYN, you may not see your doctor every year as you're supposed to. So at Drew, I majored in neuroscience and French. So one of my mentors here was Dr. McKittrick. I know she's still here. And I know she does a lot of women's health. So for me, that was really influential, and I did research with her as well. I did like looking at sleep studies and psychology in terms of rats. But I guess I also really like Dr. Denaway's microbiology. I don't know. It's just, the material is really dry, but he makes it very entertaining. So for me, that was a really important class in my decision to pursue. If you were to take a gap year and you're interested in midwifery, what should you best do? Okay. I think a lot of people have the misconception that you need to do something science-related with your gap year. I think a lot of people are looking for candidates who are doing more social issue improvement. So for me, I would say, like, if there's anything that really interests you, such as for me, it was Peace Corps or something like that, that's really good to have on your resume. If you were to pursue something like, if you wanted to do lab research, then maybe you should do lab research. But for you, I would say, find something that you're really interested in, something that you can talk to other people about. And so usually interest is contagious, and it looks really good on your resume.
Question here, how would you go about further education after your bachelor's if you want to work abroad? Not sure if that means if you want to work in healthcare abroad or you want to get a job and take courses to further your study. in the latter scenario, it's probably a little bit problematic if you want to go to medical school in say, Europe or anywhere outside the U.S. A lot of times there may not be training in different countries, and it's also reciprocal. Like if you train in the U.S. and you want to be an attending physician in Europe, they may make you go back for some training there. So it's kind of difficult to do medical training outside the U.S. and apply it back in, but I think it looks good for anybody's resume applying to medical school to show, diversity in their studies, especially non-medical. Study art history or religion. I think one of the most important things in medicine is that you really need to be kind of a person of the world and not just be a science-focused person. So I would encourage that, but if you're looking to apply credit for for medical school or training by working abroad, that may not be the best idea. I don't know if any of you guys want to add to that. That's a great question. I think, healthcare policy, maybe that's what I'm hearing. Those are almost areas you migrate towards. One of the best things about medicine, it gives you great looks at lots of different things. You can go down the rabbit hole of research or academics or private practice or healthcare policy. I, fortunately, in my life, became involved in public health I was the president of the Board of Health in the town in which I live. And that was a great experience. I learned a lot about population health. I sit on the board of directors at University Hospital in Newark, and there's a lot of public health policy as well as just healthcare policy within the institution. So that's something that you may not have time for when most of us are so busy taking care of patients. We don't really get too involved in that because we're doing what we love, which is in the operating room or in the exam room, and that's like the best part of medicine. I mean, they always say, don't forget the one that brung you to the dance. Out of all the things I do, the most enjoyable thing I do professionally is face-to-face interaction with the patient. So I don't know if you have any other comments on that.
I mean, right now I work at University Hospital in Newark, so for me, there's a lot of social issues there that can be addressed. I feel like if you feel like you have the need to fix something, there are so many venues for that. Like, for example, for us, social work, for me, like, I'm really interested in postpartum depression. So if there's somebody who, we send out like a survey after everybody gives birth. So if you score over 12, then you get referred to the social worker. And the social worker is actually our first person that the patient will see in terms of, do you have everything that you need in order to move on to support your baby? And then if the social worker feels that you may need something else, either medically, then they may refer you to the psychiatrist. As a physician, we can probably see if a patient is depressed or somebody that needs medical help, but in terms of the other aspects of somebody's life, I feel like the social worker in that sense can really do a lot for a patient and give them the resources that they need.